Good day, my name is Tareen Dawood and I'm a student at King's College London in the School of Biomedical Engineering. Today we'll talk to you about my preliminary investigation looking at uncertainty-aware training for cardiac resynchronization therapy response prediction. And now for some background. Here we have a high-level architecture for a medical image classification model. The final outcome is a binary one, to which, for instance, it could be predicting if a patient responds to treatment or not. However, with these deep learning models, we actually have many complex layers that are often developed without consideration of how the model is actually going to be used in clinical practice. As these final binary outcomes actually have many other clinical variables that are involved in order to reach this final decision. Therefore, we need to find ways that we can develop trust in these predictive outcomes so clinicians can actually use these models on a day-to-day basis. One of these ways is that we can quantify the uncertainty of our predictions, and doing so will help us to develop a decision support tool. And now for some background on our application. Cardiac resynchronization therapy, CRT, and deep learning models. CRT is an established treatment for advanced heart failure patients, but 1 in 3 do not respond. Therefore, there's been some research into how one can leverage DR capability to aid these predictions. But the reliability of these predictions hasn't been considered, and this is where we can look to incorporate uncertainty quantification to develop this trust in our predictions and make them more reliable. There are two forms of uncertainty, often estimated, and these are aleatoric uncertainty, which refers to the uncertainty in the actual input data to your model, and epistemic uncertainty is the uncertainty in the model itself after it's been trained. There are some established methods to quantify uncertainty. The two I mention here are dropout and sampling. With these uncertainty estimates, we can actually then use it as knowledge to train our models and minimize confident wrong predictions and maximize confidence right predictions. This then leads us to the aim of the project. Here we took some inspiration by looking at the literature from Ding et al., who proposed uncertainty-aware training for segmentation tasks. Here they were trying to maximize performance on confident outputs with less concern on low confidence of wrong predictions. This then allowed us to inspire a preliminary investigation looking into uncertainty-aware training for a classification problem, to which then we could investigate its effect on the aleatoric and epistemic uncertainties of a DL-based CRT response prediction model. Now for the materials and method. The materials were 10,000 CMR short-axis images for healthy and cardiovascular subjects. We had additional 300 CMR scans for heart failure patients, and we also had 73 CRT patients scans as well. For ease of use, I'll speak to two models which were used and developed in this project, which are the baseline model and the uncertainty-aware model. The uncertainty-aware model had an additional loss term, but both of these models had the same architecture, which consisted of a unit segmentation model, a variation autoencoder, VAE, with an encoded latent space that was used to develop the classification network. Furthermore, to the method, we also had uncertainty quantification, which was for the aleatoric and epistemic uncertainty. And as highlighted in the diagram, you see the aleatoric uncertainty was estimated using time dropout, and the epistemic uncertainty was estimated by sampling from the latent space of the VAE. Now, to move on to the method for the uncertainty-aware loss term. Our baseline model had 3 losses, which were the reconstruction loss, the KL divergence loss, and the classification loss. The uncertainty-aware loss term was then added to this for our uncertainty-aware model. Before I show you the equation for the uncertainty loss, let's just understand what it does. And essentially, it tries to evaluate all pairs of correct and incorrect predictions with respect to their probabilities and then try to penalize our incorrect predictions. Furthermore, we introduce another hyperparameter, m, which further then separates the incorrect and correct predictions to rank incorrect predictions higher. Here we have our uncertainty loss equation. As I've mentioned, the m, the hyperparameter, p are the class probabilities with respect to true positives, false negatives, and true negatives. As an example, if we just look at the one term, evaluating false positives and true positives, and look at two scenarios. The first scenario being when the probabilities for our true positives are much higher than the probabilities of our false positives, we will have an uncertainty loss of 0. In the second scenario, if we have our probabilities of our false positives greater than the probabilities of our true positives, then our uncertainty loss will be dependent on the difference between the false positive and true positive probabilities, but also by a margin of m. Once this was implemented, we then trained the baseline and our uncertainty-aware model and measured the uncertainty estimates and then compared these models on their performance. This was done with the aid of nested cross-validation. And now for some results. Here on the left we have two tables, the first one being a summary of the epistemic uncertainty and the second one looking at the summary of aleatoric uncertainty. Within each table we have a comparison between the baseline model and the uncertainty-aware model, and on the left we're looking at the confidence in the predicted responses. Now, looking at our preliminary investigation results, we see that there are some positive outcomes. In particular, we say there's some encouragement in terms of our confident correct predictions, and this I refer to as a true positive movement, as I've indicated with the green boxes. If we look at the epistemic uncertainty, you'll see in the high confidence bands, we actually have some positive movement, and more of the patients actually move into the more confident bands for the correct predictions. We also see that in the aleatoric uncertainty case. We also see that there's some reduction in the confident incorrect predictions, here referring to the false negatives, but they're not reduced considerably. These are indicated by the orange blocks. Lastly, we also noticed there was some stability in the false positive confidence for the epistemic uncertainty, as you can see here, with no patients sitting in the high confidence bands for the incorrect predictions. And now for our discussion. Upon looking at the outcomes from uncertainty awareness loss, we saw it did encourage movement to more confident correct predictions. However, this was not evident across all predictions and outcomes. Upon looking at the literature on how we can improve this, we noticed that what they had mentioned was that with softmax probabilities, they actually showed to overestimate confidence in predictions. Therefore, we would look to methods that can provide more calibrated uncertainty estimates. For instance, for aleatoric uncertainty, we could look to changing the architecture and including a probabilistic unit segmentation model. Additionally, we noticed in literature, hard labels are often linked to overestimated confidence in predictions. Therefore, we aim to then investigate the use of a soft label approach. Additionally, the other potential is to look at other data sets for cardiac image classification models, or if possible, utilize more CRT data. And with that, I would like to conclude and say thank you to everyone who was involved in this preliminary investigation, especially to my two supervisors, Esther and Andy. Thank you.